Welcome to the Couples Expert Podcast with Stuart Fensterheim, LCSW, your source for the latest tips and practical down-to-earth advice on creating emotionally connected, thriving relationships. Now, here's Stuart.
Hi there, and welcome to the Couples Expert Podcast. This is Stuart Fensterheim, the Couples Expert. I am so excited to be back today because what I know is when I do these podcasts, it always seems to be a great day. I love meeting all the people that come on my podcast, their guests, and giving of themselves and giving to all of you what is so very important, which is learning how to have a close connected relationship, because there's nothing more important than that. I met with someone today, as a matter of fact, who's struggling because she doesn't feel like her partner is passionate about her. There's all this confusion and disappointment and wondering why, after such a brief period of time, it feels so lonely in her relationship. The loneliness just devastates her. It feels and has her questioning everything about the two of them, including, is she attractive to him? Does he feel that she brings him joy? Because for her, having a loving relationship is what it's all about. And isn't that true? Without someone who we find is significant and cares about us more than anyone, we just feel like our world looks dark and bleak. And what I know is that each and every week, when you guys join me here on my mission to have relationships that are meaningful, significant, and where you know that you and your partner are in this world together, loving and living and having a secure relationship in which there is nobody in this world that means more to you and that you mean more to, just really has you knowing and feeling that the world will be okay and that you can accomplish anything. And that's part of why I wanted to bring on the gentleman I'm going to be bringing on the show today, Dr. John A. Robinson. Dr. Robinson is a naturopath physician who I met in a business meeting a while back, and he and I have gotten to really feel like we're kindred spirits because we both really have the same mission. The mission to really find a method, find a way to have a relationship where both people feel important and know that the feelings that you have are real and authentic, because it really is about authenticity. And so often, so many things can get in the way of us knowing that, both psychological things as well as medical. And that's why I'm bringing him on. Let me tell you a little bit about John Robinson. John Robinson is a board-certified naturopathic doctor specializing in what's called bioidentical hormone replacement therapy. Since 2006, Dr. Robinson has helped thousands of patients with hormone imbalances, and it leads them to both an improved health as well as a feeling that their life is in better hands. Dr. Robinson has a practice in Scottsdale. He also practices with his wife, Dr. Christina Romero Bosch, who's also a naturopathic medical doctor. And he and I just really talked briefly about this topic. So there's a lot that we are going to talk about that I'm going to learn, and hopefully all of you will learn, is how the hormones in our body really can have an impact on us. And not only impact us in a little way, but in a huge way. And that what we're going to do is really learn about how hormones can impact us to a point where it can have such a devastating effect on the closeness and cause triggers in our relationship that can get in the way of us feeling close and connected. So, Dr. Robinson, welcome to the Couples Expert.
Thanks for having me.
What I always start my show with is asking different guests how they got into their line of work, a little bit about what brought you into being a physician, and then more importantly, to specialize in an area that's a little bit different than a lot of doctors, which is focusing on hormones?
Yeah, I have always been interested in helping people. I think that even beyond that, I've always wanted to serve. And early on, I actually became a licensed massage therapist when I was very young. And that kind of started off the whole process for me, working with people on that level. And as years went by, I just continually was looking to expand my knowledge and how I could continue to serve. And that led me to acupuncture. And I did a certain amount of time with that. And then the next stepping stone was medicine. And I explored traditional medicine. I explored osteopathic medicine. And then I also explored naturopathic medicine. And so I had options of where I wanted to go. And after I weighed it all out, I really just went with my heart and what I thought was the best choice for me in order to serve. And that was naturopathic medicine. And the reason I chose that was because I was really able to spend the amount of time that I wanted to with patients, get down to the actual root cause of disease and work with people on that level. And it could be said that maybe sometimes in conventional medicine have their strengths, of course, but I think a lot of that one-on-one is missed. I think that's what patients are looking for. So I went after that because I wanted to be able to have that level of intimacy and to be able to really dig into the real root cause of why they were feeling the way they were. And that led me to naturopathic medicine. And then once I got into naturopathic medicine, I decided to specifically specialize in hormone replacement therapy. And when I was getting into school, natural bioidentical hormone replacement therapy was really starting to become very popular, much more popular. And it was just a natural progression for me because with hormones are about communication. It is an impetus for change. And I really like the idea of helping people to change. And that's what a hormone is all about. So for me, it was a natural progression even in school. And I've been doing that now for the past 10 years.
So a hormone is really our body's way of communicating things, I'm hearing.
It is. It's a way of communicating change. The body is sensing a certain need for change, and it will send a signal to induce that change. And there's different messages with different messages for change. And that's what I think a lot of people are looking for. I think when they come to see you, they're looking for change. And that's the thing about change. And what I've learned, change happens in an instant. In fact, hormones happen often for people in an instant. But it's progress that is the thing that takes time and it takes effort. And that's the same thing with hormones. So a lot of times we need to have hormone replacement therapy in place continually over time. And that's where the real progress starts to come into place for patients. And I've seen this over the years. So that would be my sort of analogy.
So we're change agents, both you and I, but just in different ways. You do it from a physical way, and I do it in helping people really understand their interpretations of the relationship and those types of things. One of the things you said earlier, though, that I think my audience may not be as familiar with is the difference between naturopathic medicine and conventional medicine. You said that you have gone both ways. Why one or the other, and what is really different about those?
Conventional medicine, another name for it is allopathic medicine.
Say that one more time, please.
Another name is allopathic medicine.
Okay.
So traditionally, they're viewing the body and they're viewing disease as an entity, as a thing that needs to be cut out or told to be quiet. And in naturopathic medicine, we view disease as a process, as something that had a beginning and will have an inevitable end, and has a hope for that, and that you can actually study the process of disease in a given patient, and then you can harness that understanding to help with helping them with the process. So it's a very different way of looking at it. And when you're looking at process and studying process with a patient, you're gently trying to allow them to change into a particular direction that helps them to really, truly understand themselves and understand what health means for them. And that's really what I define health as, is something that really understanding the true underpinnings of your own being. And then when you can really understand that, that's when you can really experience health and life.
So if you understand the disease process and you really understand how your body goes from one part to the other, as a naturopathic physician, you can help the body do what it needs to do to help it cure itself, basically.
Exactly. We're honoring natural courses. We're honoring nature as it presents itself. And sometimes nature presents itself in a way that we need to quickly intervene. And obviously in emergency settings, we need to do that. But most of the time, we can intervene in a gentle way. And it doesn't have to be so violent or so suppressive. What I want to do is reveal the process so the patient can see that for themselves. And that's where true healing really lies.
Within the understanding of what happens.
Exactly. And it's gentler on the system. So that's maybe a lot more esoteric, but practically, most of the tools used in naturopathic medicine do not have side effects associated with them or very minimal side effects associated with them. Most of the tools, drugs, and surgery used in allopathic or conventional medicine really often come equipped with side effects and really bad ones. But again, this is not always, my wife, who's also a naturopathic physician, comes from a family of conventionally trained physicians. And so I see the power in both very intimately. And as a naturopath, I learn what a conventional medical doctor needs to know also.
What is the difference in the training?
The training is essentially the same, except we get a lot more natural therapeutics. So my first 2 years of medical school would be very, very similar to an osteopathic physician or a regular medical doctor. It's based on the basic sciences. And then I did a 2-year board test for that, the same way a regular doctor would do. And then in the final 2 years, where conventional medical doctors are doing clinical rounds, I was doing clinical rounds, but I was also still learning new things in the classroom setting, where in a conventional medical model, they're not really doing didactic or classroom setting learning in their 3rd and 4th year. They're just doing clinical rounds. So I was doing the clinical rounds as well as additional didactic information. It's just there's so much that you have to know in naturopathic medical school that they are putting quite a bit of information in the first 4 years.
Would it be fair to say that a naturopathic doctor tends to spend more time with needing to understand the individual, both from an emotional, psychological way, and almost like a bedside manner becomes a little bit more important with a physician that does that?
Yes, you're exactly right, Stuart. It's the key to what naturopaths do. It's understanding the mental, emotional, physical, even spiritual side of what someone is experiencing. And when you can encompass as much of that as you can, then the doctor understands more, and then the patient understands more.
That actually makes so much sense to me, Dr. Robinson, because when you and I have talked about things, one of the things that and why I've even asked you to come on the show is I get a sense with you of a caring nature. My gut works really well professionally for me and also personally. And, your gut begins to say certain things to you. And I've always got this experience with you where it has felt like this is more than just a job to you, that there really is a passion here. And that's one of the things that I think is so missing with a lot of physicians, is that passion to really heal and to pay attention to more than just what the physical symptoms are.
Yeah, and thank you for that. I really appreciate that. And I'm glad that came clear to you, because that's exactly how I look at it. I'm on a mission. And I think from very early on, it was that I wanted to be able to, I keep saying this word, serve. Sometimes I don't even like to say the word help, because help implies, that I maybe know more or that I'm above my patient. And I don't look at it that way. When you're serving someone, you're putting yourself directly on their level. And I feel philosophically, I come from that bent. And I think it helps, to use that word, it helps patients more.
You said you don't help anyone. I think you actually do, though, Dr. Robinson.
Yeah, yes.
I don't think you need to be afraid of the word help. But what you just described, which to me is such an essential experience of healing, which is what we want from clients or patients or whatever you want to call those that we help. You want them to feel that they have the capacity in their hands to be able to do what is necessary to affect the change in their life, and that you and I are just has some information we're sharing, and then it's really up to them.
Absolutely. I view myself as a catalyst. I'm a big believer that I don't really believe that people are broken. I just think that people have perhaps a poor understanding of their resourcefulness, but I don't think that they're just broken. And so I come from that perspective. It might really appear that they're broken. And sometimes I am feeling like I'm fixing things up. Right. But I do my best to perceive that they have within them the ability to change, and they might need some guidance along the way, or a catalyst, which might mean a hormone or sometimes a basic understanding about their diet or whatever it might be, but that they can get to that point on their own. And I think that you're doing the same thing. And that's certainly what I appreciate about your work.
Yeah. And I think it is so sad for me to have couples come to see me and really view their relationship as so broken that there's nothing that can be done. And I think that is really why I decided you coming on the show would be a good idea, when for the most part, I only bring on couples counselors, is because what you offer folks is the knowledge that you're never that broken, that even if there are deficiencies or sexual issues or hormonal issues, you don't have to just live with the pain, that there is alternatives. There's something that can be done to have your life feel more fulfilled.
Yes, I agree. And I like to use the word heal, sometimes even more than cure. The word heal means to make whole again and bring back together again. That's what people are looking for, whether sometimes they know it or not. And that's certainly what I do in my practice.
Talk a little bit about who you see and the kind of clients that tend to come to see you, and how you help those folks that you see and serve.
Right. So because I focus on hormone replacement therapy in general and looking at things from an endocrinology standpoint, which just means the study of hormones and hormone systems, because I look at that, I tend to work with a lot of menopausal women, perimenopausal women, men with low testosterone. So probably the large majority of our patients are men and women from, let's say, 40 to 70. But we work with people much, much younger, and I've worked with people in their 80s and as old as 90. So I always say with hormones, it's never too early and it's never too late. But generally speaking, it's sort of this perimenopausal, things are starting to change. How you're feeling is starting to change. People are getting a little bit more tired. The libido is starting to go down. The moods are kind of not as stable as it used to be. They're feeling really stressed. And that tends to be right around 40 plus for a lot of people. And then they start to come seeking out help.
So would you say that the intimacy tends to be what brings them to your door more than anything else?
If I had to pick two symptoms that drives most men and women in, it would be energy and libido. I'm exhausted and I just don't feel like doing it anymore.
And the two are so interrelated, aren't they?
Absolutely. Yeah, absolutely. And sometimes not, but you're exactly right. They are very intimately related. But sometimes I'll correct maybe the energy, or they say, no, I got plenty of energy, but psychologically, I just don't feel like it. Or functionally, I can't have intercourse, or I just don't feel like even trying to do it.
Right. And I think that differentiation is important, and I'd like you to do that for us, which is, what is the difference between a libido issue and, let's say, erection dysfunction or an ability to maintain or achieve an erection?
Yeah, and that would include functionality for women as well. So
thank you.
So for libido is the psychological desire and drive to say, I want to have sex. I feel like it. The dysfunction can come organically. That would mean for men, they would have issues with erectile dysfunction. That means they want to in their minds, but they can't actually get themselves to achieve an erection or maintain erection. And for women, the functionality could be, well, they could have the libido, they psychologically want to, but functionally they can't because perhaps they have vaginal dryness or just pain in general. And a lot of times that comes from dryness, it comes from literally changes in the vulva, and that's from a lack of hormone. So those two things are often related, but also can be very, very separate. Many people say, I really feel like I want to, but I can't. Or they'll say vice versa. I can, but I just don't feel like it. And hormones can help with both of those things.
What I think is interesting about this is because when I begin to talk with couples about their sexual relationship, and one of the things I guess I want to throw in here is that how many therapists I know who don't even want to touch the area. And I don't know how you see a couple and not talk about their sexual life, but there's so many people out there that are so afraid to have the dialogue. And I think part of it is because the expectation is when you begin to talk about things like vaginal dryness and you want to start talking about hormones, the first words out of everyone's mouth that I've ever said that to is, I would love to, but the risk is too high to me developing ovarian cancer or some sort of oncology carcinoma. Yeah. And I'd like you to address that because I think that is one of the most misunderstood situations out there.
Really glad you said that. Interestingly, right before you and I got on the air here together, I just posted on my website, which is hormone-zone.com. I just posted a blog entry that is entitled, Does Hormone Replacement Therapy Cause Cancer? And does it specifically cause breast cancer, which is one of the big concerns? And really the answer is no, it doesn't. And there was a lot of hype that happened in 2002 when the Women's Health Initiative, the WHI study, Women's Health Initiative study was abruptly halted in 2002 when they examined the data after many years. I mean, it had gone on at that point since 1991. And they examined the data and they went, oops, it looks like hormones are causing breast cancer and uterine cancer. And so the study was abruptly halted. It gets media hype and suddenly everyone's taken off of hormone replacement therapy and feeling horrible. But everyone was really concerned at that point, doctors and patients alike. Now that we've had many, many years since 2002 to re-examine all of this, we've seen that a lot of it really was hype. And that most of the issues, though, and here's the big thing, and this is what we've known right away, that the issue was that what they were studying in that large study was synthetic versions of estrogen and progesterone. So what we focus on at the Hormone Zone are natural bioidentical versions of hormone. So it's the same exact biochemical shape as what your body would normally make, whether estrogen or progesterone or testosterone. So when you're working with something that is natural in its chemical shape, the body understands and recognizes it, and it doesn't come equipped with the same level of disease risk, particularly breast cancer. And there's been large studies to show this. And I talk about this in this recent blog post. One particular very large study was called the French cohort study that a lot of people in the U.S. don't know about, but it was over 80,000 women over 15 years. And they studied synthetic versions of estrogen, a synthetic version of progesterone, and then a natural form of progesterone. And they also, of course, studied women on no estrogen or hormone replacement therapy at all. And they found that women on the synthetic versions had a slightly increased risk for breast cancer, but the women on natural versions of particularly progesterone had even a lower risk than the women on nothing. So it's even argued that being on no hormone replacement therapy, you're at a slightly higher risk perhaps than being on natural forms of bioidentical hormones such as bioidentical progesterone or estrogen. And there's much more to the story, and I would encourage your listeners to check that blog post out and other resources that I put on there for people to explore for themselves. But bioidentical versions do not increase the risk. If somebody is on a synthetic version, then I would encourage them to get off of it, and that may perhaps increase the risk. But even the synthetic versions, particularly synthetic estrogen, we're finding really just isn't increasing the risk for breast cancer. Synthetic progesterone, that's a different story. That is definitely increasing the risk for breast cancer, and we've seen that in several studies. But again, that's the synthetic versions.
And so what you're really suggesting here is that, number one, the misinformation really has caused a lot of couples to deal with some really awful symptoms when they don't have to be. And number two, that misunderstanding and that information that's out there, they really have studied it now quite a bit to know what is healthy, what is okay, and what's not okay.
Absolutely. And if you can find a physician that is using natural bioidentical versions of hormone replacement therapy, then you're putting yourself into a situation where you're not increasing your risk for disease. And by the way, for men out there, that includes the concerns about prostate cancer and testosterone. That has just been proven false over and over again multiple times. There's a Dr. Morgenthaler out of Harvard who has written about it extensively, who's a urologist out of Harvard, and there is no increased risk with testosterone replacement therapy and prostate cancer at all. And most people are starting to come around and really agreeing with that. But unfortunately, in medicine, in any branch of medicine, old dogma dies hard. And we're still kind of seeing the repercussions of that, but we're slowly coming around for both testosterone for men and estrogen and progesterone for women.
And the sad thing for me as a couples counselor is how many couples that I have seen over the years, particularly I hear this from women who have been in excruciating pain sexually, and not saying anything to their partners because they're worried about the partner's reaction and the impact on the relationship to basically not have a sexual relationship, and how to really maintain a closeness when their experience sexually is just like a number 8 on a 0 to 10 scale of the pain.
Yes. Yeah.
And what would be your advice, other than obviously seeing you? Oh, by the way, I want everyone to be aware that all the studies that Dr. Robinson has mentioned will be on the show notes, along with a link to his blog so that you can get right to his website, which is www.the Hormone Zone, and be able to really read all these things that he's talking about. Hormones then are not just those kind of things. We're also talking about things like oxytocin, aren't we? And I want you to talk about that.
That's the love hormone.
Or the cuddle hormone.
You said the cuddle hormone. I think that's great. And it's true. It's a bonding hormone. It's oxytocin. We often relate this to what helps a woman to lactate. So you'll see very high levels of oxytocin in and around pregnancy and after birth. And this allows a woman to produce milk. That's one of the functions of oxytocin. But what we're finding in both men and women, oxytocin has a lot to do with bonding. It has a lot to do with helping with stress. They're actually doing work with autistic children. It's helping with social anxiety. Another thing that it helps with is good old-fashioned libido and helping with erections. But what it really does, too, is it helps with orgasm. So sometimes I'll have patients who their libido gets enhanced from hormones. Erections are fine. They do not have vaginal dryness, but they might start maybe developing issues with orgasm. And oxytocin can be that hormone that helps to achieve orgasm as well. But what's great from a psychological standpoint, what oxytocin does for women is that it tends to make situations that seem really intense for women, it helps to bring it down a few notches. For men, where we tend sometimes to maybe not have enough emotion into a certain situation, it helps us to become more empathetic and emotional towards a situation. So it brings us up a few notches. And that helps both men and women to sort of meet in the middle. And that's some of the interesting things they're doing studies with that now with oxytocin.
So empathy would be helped in that way.
Yes. And I think both men and women need that. It could be argued that perhaps men sometimes need that a little bit more, and it might be able to help that way too.
Because one of the biggest challenges I have with couples is how we interpret our partner's behavior, and that when we're triggered, we usually interpret it in the most horrible way you can imagine. Seeing someone as this is an unfeeling, uncaring so-and-so, and feeling like what you've just described is your partner as a fact, not an assumption, what I'm hearing is that if we can shift that, and that sometimes the hormones is part of what gets in the way, we can really change the nature of how we see each other.
Yeah, it's interesting you say the word see, because interestingly, with oxytocin, one of the best ways to enhance oxytocin naturally is just simply to look eye to eye with someone, to literally gaze right into their eyes. And so they found that just simply taking a few minutes to look in someone's eyes will start to increase oxytocin for both people. And I would think from a counseling standpoint, perhaps that's one tool to be able to increase oxytocin, which then in turn helps with empathy and understanding that this person sitting right in front of you is a person and has their own perspectives too, and that might not be all that different from yours.
You know, you remember as a kid, we used to play that staring game?
Yeah.
Where we stared each other in the eye, and how long can you do that until you start getting so uncomfortable?
Yes.
It's almost like it's a very vulnerable act, and that's really what you're describing.
It is, yeah. And there's also another side to that. The longer you stare at someone, there is like a dysmorphic kind of thing that will happen too. And I was reading the studies about that. But with a limited amount of time, you can increase oxytocin. And I think that could be just a simple way that couples could just take a few minutes each day and just simply gaze into their lover's eyes. And I think, we used to do that maybe early on in relationships, and then we forget about those basic things. But those are the things that bond us together. That eye gazing is increasing oxytocin. And then when you're feeling those levels of oxytocin looking at a particular individual, that's helping you to continue to bond.
So in terms of relationships and hormones, how do you see them coming together? I know you've talked a little bit about that, but I'd like to hear a little bit more about how should someone decide whether or not a consult with you would be a helpful thing for the relationship?
I've had patients sit in front of me, a husband and wife with both their arms crossed, and say, this is it. This has to be the thing that's going to work. We're looking for something to spark our relationship again or reignite it. And so for people that are looking for that ability to be able to reignite, that know they have that choice, I would love to meet them and I would love to be able to serve, because hormone, when it's done correctly, it really can change people's lives. It can give them that spark again. I have many, many people that come in and say, I absolutely love my spouse. I have no issues whatsoever with my spouse, but something's missing. And a lot of times it is that physical hormone. And when you have the ability to replace that, that's the missing key. And that sparks and reignites the relationship again in a real special way. And I see this for people 40s, 50s, 60s and on. They're looking for that something special. So a lot of people are looking for those things. And if you are, then the hormone zone is here for you.
And do you differentiate that from people who are just so angry and that it's the anger that's getting in the way, as opposed to looking at each other and saying, I'm no longer attracted to you?
Yeah, it's the anger. It's the frustration. It's the lack of energy. It's the just mood instability that they're having anyway, just in general with their lives. And then that obviously translates to their relationships. As you can start to pull back some of these other issues and start helping with some of those other issues, then they have the space, they have the energy to put back into their relationship and then be able to reconnect.
So really, you're actually saying a few things here, because as I'm hearing it, in some ways, if a couple's been working on their relationship and the counseling or whatever they're doing, it doesn't necessarily even be counseling, should be working, but it's not. Those are the times to maybe take a look and go, what else could be going on? And then maybe coming to see you as a consult even.
Absolutely. Look, people can have issues with headaches. They could be having, just other mood instabilities. Have nothing really in the end to do with their partner, but that just exacerbates the issues that anybody might have with their partner. Another thing is that I focus on thyroid issues, and I also focus on blood sugar control issues with patients. So a lot of times people are acting irrationally because they might have a thyroid issue. And thyroid hormone affects the brain in massive ways. The same thing with blood sugar. so many times people feel the way they feel simply because they're not eating properly and their blood sugar goes low, and then they have erratic behavior. And so if we can control those things, then they feel more stable. And then again, relationships, whether they're personal, intimate relationship with their spouse or any other relationship, work or whatever it is, other family members, all of those things start to become enhanced. And then it's a collusion in the right direction where all these other things are starting to help. And then it makes it easier for your personal relationship. So yes, the answer is I've had many people over the years, many other therapists refer patients to me, and they were able to get to a certain level with their clients, but they just couldn't get all the way until they had hormones bounced. And by the way, that goes the other direction. So I've had patients where I've corrected everything that I could correct on my end, but there were still some things that were missing that until they went and dealt with those emotional barriers with a therapist like you, they wouldn't be able to get exactly where they wanted to go.
And one of the things you and I have talked recently about, I want to sort of, as a precursor, telling folks that you and I are in the process of some talks about possibly doing some community presentations out there on looking at a really holistic approach with myself and you, and possibly including someone who is involved with physical training, because the three holistic approaches, the health and wellness approach, really is how you really help the complete person.
Absolutely. That is also, again, the tenets in naturopathic medicine. We want to look at the whole person and treat as many angles as possible, because when you're working holistically there, comprehensively, 1 + 1 winds up equaling 3. It's more than the sum of its parts. So as people are working synergistically with multiple things in their life and their health, they just get better easier. And they appreciate that.
And we go to a specialist to different parts of our body all the time from a conventional medicine. Why not also look at doing that with some other forms? Because unless we see it in front of our face and we all only know certain things, that I think having a team approach, both with providers that work with couples as well as, physicians when you're talking about disease, everyone benefits from that.
Yeah, I agree.
So I wanted to just thank you again for giving of yourself, giving of your time, giving your passion, because I think the more providers out there, the more physicians, the more therapists that really understand that unless relationships are in good shape, we all see everything so bleakly when the relationships in our lives aren't working. And that if you can really find the pathway, whatever way that is, to really understand that you and your partner are in this together, and that it's working with one person in your life that you matter to, that everyone, all the energy goes in helping the two of you feel loved, everyone benefits. So thank you again.
Thank you. Thank you for having me.
All righty. You guys take care, and we'll see you next time. Bye-bye.
Thanks for listening to today's episode with your host, Stuart Fensterheim. You're one step closer to reigniting that fiery passion with your partner. For more information
and your 30-minute free phone consultation with Stuart,
visit www.thecouplesexpertscottsdale.com. We'll see you next time.